Welcome to the 1% Doctor Podcast. What separates the good from the great, the standard from the extraordinary? It's mindset, it's execution, and it's the relentless pursuit of growth. I'm Adam Lamb. I'm your host. Welcome to the show. Welcome back to the 1% Doctor Podcast. I'm your host, Adam Lamb, with a special guest today, Dr. Daniel Savarino. And we're going to talk a lot about regenerative medicine, health optimization, just maybe some things that you don't understand fully if you're a listener and you're considering some of these things. But also, if you're a doc and you're out there and you're thinking about, moving away from some traditional medicine stuff and you're just unfamiliar with different modalities that might be there, Dr. Daniel is going to share some awesome stuff today on this podcast. So I'm excited to have him. First, I want to start, give us a little background. What got you into medicine?
Sure. So actually, it's a story. When I was in eighth grade, I was on a school trip to Montreal, Canada. And on the way home, even though it was April, there was snow that day. And we were driving home in a coach bus, and coach bus hit a patch of black ice and literally rolled over like a 70-foot embankment, So yeah, so I was at the bottom of this embankment. I had to climb myself back up, even though I didn't know it at the time, but I had a huge gash on my leg. Got into some woman's car who just happened to be a nurse who pulled over because she saw the bus go over and looked down and I saw I was bleeding everywhere. So they're throwing towels on me, throwing jackets on me. And then, I'm in the emergency room. We get to the ambulance, we get to the emergency room, and they're sitting there and they're looking at my leg and they're doing all this stuff. And, and I just found myself really more intrigued than scared, like I wanted to see what they were doing. They kept having to push me down because I was trying to look at what they were doing, and from then on, I was always just really interested in medicine, so that was basically, the thing that really lit the fire.
Were there other people injured?
Yeah. So, there was 20-something kids, 2 teachers, the driver, 2 kids actually passed away in the accident. So yeah, it was a big thing. Yeah.
Do you think that any of that was any traumatic experience? Do you have any issues with, I'm not laughing, but like riding buses? It's as a parent, I don't know if you're a parent, but those are, dumb stuff we think about. Field trip, it's like, who's thinking of a bus rolling down a 70?
Exactly. Yeah. I mean, for me, no, I don't have fear of anything like that. Actually, I guess it was a little unfortunate, but maybe good too, is that, how did we all get home was we had to take another bus home, because we were all the way up in Glens Falls, New York, which is, close to the Canadian border, and we were in Long Island, So I would say, if anything, though, it probably made me more fearless, it just kind of, yeah. So.
What are the odds? I remember my son, this crazy story. I literally bought him, it was before he was 16 and could drive, but I bought him this Jeep that I wanted him to start practicing on. And we had a pair nanny it was like her car too. And so she'd drive it with him. Literally I bought it on a Saturday, the next day, Sunday. And I bought it because I thought it's safe, big tired kind of Jeep Wrangler, The next day after I bought it, they're driving. Some lady turns out in front of them, whack, and they were fine. The lady's Hyundai totaled, and the car, the Jeep just needed a little bit of an alignment, right? But there was a part that it made him realize the reality of accidents happen, dude, and it also gave me the confidence as a dad, as I feel like I got a pretty safe, vehicle for him to be in. So that part was good. But not to get off track, the point is that it's interesting, and I remember you telling me the story when we first met, how accidents can shape our lives, and not just vehicle accidents, just unexpected situations in life. And it's interesting how many physicians' stories, it could be a sick parent that died early, that
Yep.
led them down the path, right? And so then you decide, hey, I want to be a doctor. And so talk a little bit about the path of what happened next as you get into, the late teens, getting into college and medical school. Talk about that journey a little bit.
Yeah. So, I mean, from the time I went to college, I was pretty hell bent on going into medicine, so that was kind of the goal the whole time. When I started medical school, I was actually pretty convinced I wanted to be an orthopedic surgeon. I was like 99% sure that's exactly what I wanted to do. And then my fourth year of medicine school is a lot of rotations and a lot of electives. And so I basically stacked four orthopedic rotations on top of each other. And I just found that I still liked it, but I didn't like it as much as I thought, and I was like, if I'm really going to do something for the rest of my life, I want to really like it, So, um, then I started kind of exploring the avenue of sports medicine, and it was very similar patient population. I like to treat injuries. I like to play sports. So I'm into all of that stuff. But at the time I was coming up was right about the time like ultrasound started getting a little more mainstream and things like PRP and other regenerative treatments started coming into the fold, So in my mind, I was like, hey, I could really help people without having to do surgery. And, that's really like took off. Like that was something I was very passionate about.
I love that. I've worked with a few orthopedics. I was actually just looked at my phone at a text from literally an orthopedic surgeon who's no longer an orthopedic surgeon. I helped him build up. But I had this one orthopedic friend of mine, and he would always talk to me. We talk about hormone optimization. I've been in that space for 20 years and taught physicians and stuff like that. And he would do anything I'd say on that. Like if he was like, "Hey, what do you think about this?" I'm like, "Oh, it's good. It's great." But regenerative medicine, stem cells, something like that. Like he's like, "Oh, that stuff doesn't work." And I'm like, "Dude, come on." I'm like, you trust me. Anything I tell you in this area, but over here, you don't think I know what I'm talking about. I'm like, sometimes when you're a surgeon, not all of them, but some of them are like, it interferes with, and it's like, come on, man. There's a few ways they say this, a few ways to skin a cat or whatever, right? So that's cool that you see that and you're open to it. And I think more and more, a lot more orthopedics that I talk to are interested in that because they're like, yeah, I don't have to do surgery and I could do something that's going to help this person financially. It can be good for the surgeon without breaking the bank for the patient either. There's so many different options out there, so it's pretty neat. So and it aligned with maybe a lot of the people you want to help, which might specifically have sports injuries and some of those things. I mean, tell me about your demographic that you deal with? Is it primarily like the athletic people, or is it like sometimes it's like grandpa that doesn't want to get the knee surgery, right? And he's
Yeah.
tries something else.
No, it's a really mixed bag, and what I like to really drive home to people, because I think sometimes because it's sports medicine, people think you have to get injured in a sporting or you have to be an athlete, where in reality you could get tennis elbow using a screwdriver,
Yeah,
and it's the same thing. It's the same tennis elbow. So yeah, we have a very mixed bag of, young athletes, middle-aged athletes, older sedentary people, because we treat a lot of arthritis too, with things like PRP, stem cell type stuff, So yeah, I always say I treat from basically like 5 to 105,
that's
So, and,
awesome.
and we see everything in between.
What about so like breaking into that? Do you when it comes down to so like regenerative medicine, big vast conversation. Even when we talk about stuff like stem cells, someone's like, "I got stem cells. I got stem cells." They may not have always got the same. There's such a variety.
Yep.
Was actually in the gym yesterday, in the locker room, and one guy was like, "I don't think I'm getting Sims," and I just overheard it. And rarely do I'm pretty good about minding my business. And the one guy's like, "Yeah, I think you're supposed to do it from this way." And I kind of just had to chime in and just share some, not necessarily my opinion as much as just some information. Because one guy's like, "Yeah, I go to Panama," and I'm like, "No, you don't need to go to Panama, dude." Like, there's certain, and just explaining a lot of the difference in the states. There's some regulation of what we can do, what we can't do, but a lot of it is how much are we manipulating the cellular stuff, because then that becomes a new drug, which is ridiculous, and that should be changed. If you take my cells, you should be able to do whatever you want. I should be able to put them back in me, and you shouldn't be able to tell me what I can and can't do. And that's something that I think we'll work on, especially with administration change and like this movement forward of people just having a little bit more control and saying their health. But the other part is what you can advertise, right? Like you could in Panama, I can say, "Hey, I can reverse your kid's autism." Right? They could say it. No one's gonna. I'm not. We can't say that we can do that here. And and again, everything's different. So you can't. There's some of these like cure. There's some of the regulations we have here, but a lot of the same modalities that are used in other countries are also are available here.
Mhm.
Unpack some of the different ways that people might get regenerative medicine and maybe where you might shift in, like why you would choose PRP over something like talk a little bit about that.
Sure. So, the first thing I like to say about regenerative medicine, I love them to open up some of these restrictions, but I think right now the problem is regenerative medicine is still a little bit of the Wild West. There are a
Hmm.
lot of people doing things that A, they really don't understand, and B, probably they shouldn't be doing. So I think that has to clear out. And I think when that does, you'll see kind of opening the restrictions to the people that should still be doing it.
Yep.
I'm a firm believer at this point in time, at least, that autologous, which means your own cells, are the way to go for multiple reasons. One, there's a lot of this like stem cell in a bottle stuff and all that, but we
Mhm.
know there's no living stem cells in there because if I didn't test you and make sure you were a match for those stem cells, and I just put somebody else's stem cells in you, there could be big issues. So while they might have some growth factors and healing factors like that, you're certainly not getting stem cells. I'm a big fan of your body has the potential to heal itself.
It's how
Everything you
it's
need.
designed.
Yep,
It's how
exactly.
we're designed. Yeah.
Exactly. It's all there. The problem is honestly, sometimes our delivery system just sucks. It is what it is. The joints can't get a big blood supply. Tendons and ligaments have little to no blood supply, depending on. So sometimes we just can't get enough healers there.
Well, in the state of health of the individual too.
Yeah.
If you're dealing with some neuropathy or certain thing where you already have a blood flow issue, but and you got an ankle issue, like good luck, right? And so we're coming in and doing an intervention there can actually you're putting what needs to go there
What
right
needs to go
there.
there. Yep. Concentrating it, giving a nice heavy dose of it into areas that just can't get it on their own. The different types of regenerative medicines I do. So PRP is kind of the one that I would say most people know about at this point, which is platelet rich plasma. Basically just drawing your blood, concentrating the platelets, which are the healers in your blood, and putting a hefty dose into places that just need the healing.
Let's unpack that for a second because there's so many different, obviously different things coming to the market. There's like, and I was literally talking about this yesterday with the group because we're looking at some of the PRP stuff actually for wound healing. You're like spinning it around, getting the plasma, almost turning it into a paste for wounds, and it's awesome, way better than most of the mainstream wound stuff, and less expensive theoretically than like the skin graft stuff that a lot of people are
Yeah,
doing too.
definitely.
And so, but what we're discussing is it's a little newer, like the difference, because when you're talking about PRP, so it's like draw your blood, it's in a vial, we put it in a centrifuge, essentially, spin it, separate it, pull out the platelet rich plasma, inject it, right? Like that, like that's the high level overview. But there's so many different companies and kits and certain
Yep.
centrifuges and certain things that do like, hey, you put in here, what is your thought? And it's not poo pooing on anything specific, but just like you have the experience in it. Like, is it, hey, put in the vial, spin it around, pull the stuff, stick it in, it works? Or is it you're like, hey, you know what, man, it's got to be done a little bit more like differently. So talk
Yeah.
a little
So
bit about that. Because I want people to know if they're like, hey, I'm gonna go get PRP and it's only this much here, that other guy's this. But it's like, dude, you're not getting what you should be getting, and it's not gonna work, right? So
exactly.
talk a little bit about that because I think there's just so much misinformation in the space around.
Yeah, so I mean, there are dozens of PRP products out there, centrifuges, kits, all that stuff. I would say probably out of all of them, there's maybe two or three good ones. Why are the other ones not as good? You're not getting the platelet concentration that you need. Some of the newer data shows that you need somewhere between 5 to 10 billion platelets in any one place to actually get the results you're looking for. And that's why, like, some old school thoughts and what some people still do is they'll say you need like 2 weeks apart. I mean, for me, I don't even know if the first one's working for 6 to 8 weeks, so I'm definitely not gonna do 3 in that time. I'm gonna kinda see how you do, and you might need more, but you may not.
Right, right,
Um,
right.
and I use a kit that I know I'm getting somewhere between 6 to 10 billion platelets when I do it.
And that's a kit you're buying from a third party company
Yeah.
that they have they have all the approvals and testing and all.
Yeah, exactly. Like, people can spin their own PRP. It is a little bit of like a medical legal gray area, like, God forbid there's an infection or something like that. Like, we could say this is an FDA cleared PRP device. It's sterile in nature, like where if you're doing it on your own, you don't have that proof.
Yeah, so the
So
ones you're doing, is it something you're drawing the blood, shipping it out, they're
no, so
separating us
everything
and
stays in
you're
house. Yeah.
okay. Right.
Yeah, but,
And so again,
you know
there's different experiences, right? Where some people, it's like, yeah, I went in and drew my blood and they ship it out and then it gets shipped back to me in a week or so. Like something, there's just
yeah.
different. I know, I know. And so just understanding that stuff.
I mean, I'm a little very, I guess, anal when it comes to that,
Well,
I
you and
would
I know
say
is the longer something's out of you, the less.
yeah. I mean, my thing is I don't even let usually the PRP's in the same room as the patient so that they could see it's
Yes.
their blood going in there, it's spun there, it's all done there. I don't even bring them in another room, Sending it out, I don't even know if it's gonna be the right stuff coming back.
Right, right, right. No,
So,
you're right. But it's, and these
yeah.
are things that people, if people don't know, they're just like, "Oh, I'm just trusting a Facebook ad that I clicked on." And I'm not against
Yep.
any of the things or
Yep.
advertising or marketing, but it's like there's a difference of there's bad actors out there.
Oh, yeah.
And some of them are just uneducated, they just don't know. They're just trying to make money and they're like, "Oh,
That's
I'm gonna get into
exactly what I was gonna
PRP."
say.
Right? They don't mean to do it wrong. I'll never forget being in a room. It was actually an umbilical cord tissue product that I was sitting in this room with these groups. Is all docs. I was the only one that was non-doctor in there. And they were talking about, hey, this product, once thawed from, has to be injected in the patient within 10 minutes. These other guys are like, man, I set that out on the tray for 2 hours before. Like they didn't know until
Yep.
they knew. And the
Yeah.
effectiveness of it is goes down, right? The efficacy. And so that's why I like having this conversation with you and people to be able to listen to it. So like if this is something they're looking to pursue, it's just giving them a little checklist of questions to ask, right? I mean, if they're near you in New Jersey, go see Dr. Daniel. But if you're somewhere else, let's educate them a little.
Yeah, I mean, I would say I would say probably 99.9% of doctors aren't doing anything that they think is wrong, but they're being told by some of these companies that they're just straight out misinformation. Like I've
Yeah.
actually educated some doctors in like chat forums and social media. Like I had one doctor post this picture and they took 10 cc's of blood and the company says that out of 10 cc's you're going to get 7 cc's of PRP. Right?
No way.
Now, the math doesn't math there, like,
Yeah.
I said, if you just took all the red blood cells out, it's still only going to be like 6 cc's, right? So, because plasma is 55%, red blood cells are 45%, and then plasma and platelets are, white blood cells and platelets are less than 1%, right? So, even if you took all the red blood cells out, you're still only going to get 6. So, what you had is you have platelets, plasma, and a little red blood cells, but there's no PRP in the rich.
And so, uh, did you get a thing that your thing stopped? They'll edit that. Um, yeah, and so that's interesting. So break that down a little bit. So explain like what is the platelet rich plasma? Like talk a little bit about what that is. And like I love that you broke down the percentages of certain things of, if you pull, let's say 6 cc's of blood, how much platelet rich plasma should you expect to get out of something like that? Or how much do you typically do? Like talk a little bit, maybe like what per joint, you're gonna do something different maybe for a wrist or an elbow versus a knee or right.
Yeah. Yeah, so I mean, I would say anything under 30 cc's, you're probably not getting very much platelet concentration of blood. Sees if it's like a very localized tendon or something like that. Joints almost always at least 60 cc's, sometimes even more than that, sometimes 120 cc's.
Of platelet rich plasma,
No, 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 of the blood that we
you'll
draw
draw
to
the
get the
blood
PRP.
up
Yep.
to 120. And
Yeah.
that's a decent draw
Yeah.
compared to
It sounds
most
like
of
a whole
these.
lot though, but it's really only 4
Well, I'm
ounces,
just saying
you know?
compared to what a lot of 4 ounces. Yeah. But I'm just saying of like what a lot of people are actually doing in the market. I've seen, a 12 ml vial of blood
Yeah.
and that's all
That's
they're
almost
doing.
nothing. Like, if you
Right.
get 1 cc of real PRP out of that, you're lucky. Yeah.
Right. 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 And so what do you think, like in your experience, what do you think is the best like rule? Do you have rules of thumb that you'd say like, hey, an elbow, I typically do this, knee, I would typically do this. Like how much PRP do you think someone, and it's just to give a question almost to test the doc, right? Of saying like, hey, how many cc's of PRP are you actually injecting me with? And if a doc's like, yeah, I'm going to do 1 cc in your knee, would you say that's like not likely going to be enough? Like, tell me about that.
Definitely not. Yeah. Now, how much per area is really variable because, as opposed to something like a steroid, let's say a knee arthritis, for instance, right? And you just put that steroid in the joint, kind of spreads around everywhere and does its job, right? PRP, regenerative medicine, stem cells, anything that I do, it's really all about precision, and you want to treat everything that needs to be treated, you know? So with an arthritic knee, I might treat the knee joint itself. I might treat the meniscus. A lot of people have MCL laxity that has to be done. You really want to treat the system as a whole. And
So
that's
you're
another
not
thing where like a lot of people are doing it wrong, in my opinion,
so
you
you're
know,
not just dumping it in the joint capsule. You're doing some multiple strategic areas right in it, ultrasound guided.
ultrasound guided. Yep.
And I think that's a difference in, like you said, that precision piece, those outcomes. And that's why, like you said, the Wild West aspect of it that people don't understand, like, do these products work? Yes. Are they going to make you worse? Probably not. But if it's not done correctly, right? Like if I was like, I got PRP and they put 1 cc of plasma, platelet rich plasma in, and my knee didn't really do anything, right? And you could look at it and be like, well, yeah, you probably needed X, right? And so that's where I think that there's so much of that is there just isn't been standardized. And that's what we were talking about in the conversation yesterday. We were actually talking about PRP again, going to the wound graft stuff, because it'll vary the size of the wound based on what you need. But like there's a part, and when it comes to cost, like if you're doing, like if you were going to do both my shoulders and both my knees, I mean, how many tubes would you need? Like we get into all that, and that cost, you have more cost to that. So there's going to be more expense to it. And that's where I think whether people are intentionally cutting corners sometimes, or they don't know any better and they think, like, and then the person doesn't get the result, it gives the treatment a bad name. And,
100%.
it's a waste of money. You look bad. Like, I like that we're talking about this because it's like a standard needs to be created. And most of this though is cash pay, correct? Like people are paying out of,
Yeah. Unfortunately, the insurance companies, they still love to use the word experimental. And in my thinking is, how can putting your own body back into you be an experiment? Like at the very worst, it doesn't work. Like there's so many drugs that can really harm you. Your platelets can't do that.
right.
Like,
There's so many treatments that could not work, right? That
yep,
insurance covers. And so, yeah, and I hope eventually gets to it. And that's the problem, I think, is just the lack of standardization. And once we have that standard of care really set in, and that's what you have to do. You should check that out. I don't know if you do insurance and some of your other things that you offer in the office, but like that wound care stuff, we're looking into from the PRP side, and insurance cover that Medicare is covering it. And so,
yeah,
and,
yep,
and what I like is because they're covering it, because there's approved products, kits, so to speak, that they're doing it. Like there's a way to do it. And I think it's going to open the door to getting it more down the path of the orthopedic side. So you guys can get paid doing it, and people can pay through insurance versus out of pocket because it works.
yeah. The only problem I'm always hesitant with is if they do cover it. So actually, I'm in a group with like a lot of regenerative doctors. It's like a email chat group, and one of the doctors in Texas said that one of the insurances is covering it, and they're reimbursing $30, and that includes the cost of the material and everything else.
Well, I don't know if you pay attention too much on the skin substitute, like the regenerative, like placental derived wound grafts. Conversation about those, they're reimbursing high dollar, right? I mean, you're talking 3 grand for a square centimeter, which is much, but there's still a significant cost to that product, and the products work better than just about anything else I've seen in the wound. But now they're talking about taking it down to $127 a square centimeter, and you can't even make the product for that. And so, like, it eliminates it. So there's a part of like, could we get Medicare to reimburse 3 grand for you to do a joint, like that, you could probably figure that out, and those are some of the things. And I just have a passion for, in the healthcare space, that how do we help have those conversations to help people, avoid, sure, the orthopedic guy is not going to get to do this knee surgery, but they don't always need to do the knee surgery, right? Do you still do traditional, like you mentioned, like a cortisone injection? Do you still do some of those things too?
Yeah, if needed, big swollen joint that's acute. I'm not gonna, the PRP is only gonna make it swell more. So, you want to kind of reduce that. You want to get the fluid out, put a little steroid in, see if we could calm it down a little bit. Yeah, I mean, I've definitely significantly lessened my steroid use over the years. But listen, it's a tool in the box. You do need it sometimes.
But
you
I
know?
think, and I think we're moving because the science is showing for that being like standard of care over and over and over again. You're drying out the area. It's you're kind of making it more brittle, more worse, more susceptible for further injury. And so it's like there's this space of like steroid surgery, and I think, we're like, hey, regenerative medicine is bridging the gap here that could stop this.
1,000%, and that's where insurance has to get on board, because I mean, really why that is the way it is, where it's physical therapy, try a steroid injection, and if that doesn't work, surgery, it's because that's what's covered, so and yeah, and so that's a lot of people's protocol, and, some people, don't even realize the regeneratives are there, and, listen, there's always gonna be some people that don't have the means to do it, and, so there are options, but, yeah,
They're not teaching about PRP in medical school, and is that is like a mainstream, right? So none of that's, you have to go learn that stuff on your own, and then there's like when all what does an average PRP treatment cost? Would you say?
So if we're doing one area, probably somewhere around $1,000. If we're doing multiple areas or a lot of work, sometimes it'll be a little more. Um, but yeah, somewhere in that range, 1,000 to 1,500.
You and docs are typically traditionally not taught to have conversations about $1,000, $2,000, $3,000 cash treatments. In society, we're not conditioned. We're like, I got insurance. It's free. Well,
Yep,
your insurance,
exactly.
not the best version. You want the best version, you pay out of your pocket. Um, that's an interesting part. And then kind of a segue, you do some like hormone optimization, you do some of that stuff as well. So like,
Yep.
you're definitely focused on longevity and kind of the better, in my opinion, the better way of doing stuff. Talk a little bit about that. Share a little bit about what you look for, hormone clients, male, female, anything specific. Talk about that.
Yeah, sure. So one of the questions I get a lot is, how did a sports medicine doctor start getting into hormones? And honestly, the reason is because I had these patients. We were seeing tissue regrowth. We were seeing all this good stuff with PRP. We were doing all this stuff. And guess what? They were still having issues. They were still having pain. They were still just having generalized pains. And then you start doing research and deep diving, and you realize hormones are really important for a lot of that stuff. The hormone from the pain perspective was great for me, but then there's all the other awesome benefits of optimizing hormones.
Regenerate and recover faster when your hormones are
Yep,
optimized. You're
100%.
That's what I think people miss, even like when I get into like sports and doping, and like athletes. Oh, that guy was taking steroids. Well, listen, you take steroids and don't work out. Not a lot. You're not just gonna get jacked and hit home runs. Like you actually have to train. And so part of that, it speeds up the ability to your body recover, or one could say restores your body's ability to recover to more of a youthful state. If you're still I've always kind of joked, like if you're just sitting on the couch drinking 6 beers every night, and your idea of lunch is fast food, and you eat pizza 3 nights a week, and like you're not going to notice the benefits of optimizing your testosterone. But for someone who's like, hey, I'm going to the gym regularly, and I'm trying to live this full life and active and energetic and healthy sexual relationship with my spouse, all those kind of things, you're going to see that improvement to experience life better, right?
Oh, definitely. It's a game changer. I think the other thing is, when people don't realize, like when people are on steroids, their testosterone levels could be 3, 4 times normal, like where our goal is to get you to optimal for a human being, not
High
optimal for a bull shark.
What's funny about the testosterone, just in particular, is like that's the largest range just about on any blood thing you could take, the biggest, right? And so I always use the analogy like, hey, if I were to offer you a job and I was going to say, hey, do you want me to pay you 25 grand a year or 100 grand a year? What would you pick? You'd pick 100
Yes.
grand a year. And so it's
Exactly.
where, and that was kind of the, okay, well, where do you want your testosterone, at the lowest end or the higher end? Right. And so lifestyle stuff matters, but as we age, lifestyle, you can still, your body's only going to do something so well for so long, where you might have to come in and do some intervention that helps it do that, just to align with the lifestyle, right?
Yep. Yeah. We're not meant to last as long as we've been lasting. And that's why our hormones deplete as we age. That's the process. So now we have ways where we can fight it a little bit. And I'm all for it.
Yeah, and I think also just the lifestyle stuff, even environmental things that are, in our whether it's clothing to our soap to our food, all that,
100%.
right? That's rapidly declining. I mean, when I first got into space 20 years ago, never see somebody with low testosterone under 30, and now you start seeing guys. I mean, I see guys in their mid 20s that have the testosterone of like a 60-year-old, and it's wild, right? And then that can lead to depression, low quality of life, like some of these other things, and people think it's not all about muscles or being strong or ripped or jacked or something. It's about like cognitive function. It's about well-being. It's about just general energy, sleeping better, all these kind of things when your hormones are functioning properly.
Yeah.
And, all that has to do with it. What are some of the big things that you see in that space maybe that people kind of misunderstand?
So one of the big things is I do both males and females. But one of the big things I would say is the importance of testosterone in women. So a lot of people don't some people don't even realize women make testosterone, but what they almost never realize is when they were 20 years old, their dominant hormone was testosterone. They were making 3 to 5 times the amount of testosterone than they were estrogen or progesterone. Now it's a lesser amount than we make as men. Our female range will typically shoot for somewhere around 150 to 250, where men were shooting for like 9 to 1100. But still, it's super important. It helps build lean muscle. It's very heart healthy. It's bone healthy. It's actually a breast protective. It's a great mood stabilizer. So that's the other, I would say, big misnomer is people think of testosterone as roid rage, and they're roid raging because again, their levels are 3 to 4 times or more what it should be when testosterone is. I'm sorry?
One of the other parts in the roid rage thing too, that when we did a lot of research in some of those guys, especially the abusive guys, is guess what their estrogen was? Yeah, we'd have a guy come through who's like, testosterone's 3,000. He's has symptoms of like roid rage. It was estrogen's 1,000. Yeah, the higher side of a woman. How do you think a man's going to feel, right? And so a lot of the roid rage that we did some studies on back in the day with bodybuilders that had complaints or symptoms of having that rage or whatever. Yeah, some of it could be testosterone related, but also when your body is totally dysfunctional in another manner. We think when or women, I'll get smacked a little bit by this, but it's like when or women kind of, we use the thing like PMS or, when or guess what's really, really high during that time,
Mhm.
right? When you guys ever do cycle mapping, but we've done that some cycle mapping with women who are just like, "Hey, what before my period, I'm crazy. I know I'm crazy. My husband can't say like," and we look, I'm like, "Oh, because your estrogen bumped up to 950." And so like when we can start regulating, and it could be a genetic thing, it could be an environmental thing, but some of those things happen and so it's like, again, it's not stuff you're taught in medical school, and you have to start reading research and getting around in the right groups to learn that stuff so that you can help provide that value for people. So I think anyone listening that's like, they want to connect to that, it's super important to just there's a lot to be understood. And even recently, I think just this year, they took the black box warning off testosterone, right? Which
Yep.
is should have never been there in the first place. And so
Uh,
we're starting to
yes.
see that movement in the right direction of especially, I think like my wife just turned 49 yesterday. She takes low dose testosterone for a woman and she feels great. She goes to, Orange Theory every morning, like 5 days a week. Like you wouldn't know she's 49. You look at her and think she's probably 36, you know, prof- this professional, super mom, does all the things. It's like, and she wants to have that well-being and that energy for life, right? Because she's, where some people they're hanging it up at 35, and it's like, well, then you may not notice a change in testosterone. But if you're wanting to live that vibrant life, but your hormones just based on your, chronologically where things go with age and some of these things, um, it's going to dip, and we want to optimize that so you can have that, the conversation around health span versus lifespan,
Yep. Absolutely.
right?
Yep. And it's that catch 22. Are they hanging it up because their hormones are dropping and they feel like crap? Yeah, because that's a big part of it too. They just don't feel well, once those hormones start to go down. And women lose testosterone way earlier than men and at a much faster pace. So by the time most women are 40, they've lost 50% or more of the testosterone that they had when they were 20.
Right.
So it's a big difference. Yeah.
They wonder why, like, it's like, I don't really want to do that. Or I don't feel like doing that. Or I'll just, add in some weight. It's part of my age. No, there's a lot to do with when your hormones need to be optimized. And I even think that's a big, the GLP ones that have really come popular into the space of, you know, they're great to help you lose some weight or maybe do some of that stuff. But if your hormones aren't optimized either, you're going to put yourself in an even negative situation as well. So having optimal hormones first could be a great first line of defense
Yeah.
before you going on a GLP-1 or doing that combination as well. Do you do much with the GLP-1 space?
I mean, I prescribe them sparingly. I'm not that big into it, honestly. I've become a little bit, I would say negative towards them, although they do have a lot of benefit, but it's another thing where now all of a sudden it's like you're on it and then you're off it and then you gain all the weight back. So now the new recommendation is now it's like another lifetime in medicine that you're on.
And it should be how it's supposed to be done in a clinic that I own that I sold, but we when early we were doing it, like basically we knew the FDA was going to approve it. And we did it alongside coaching. So helping you, it's like, hey, we're going to cut back your food because you can't, or we're going to teach you. I use it for me. Like even I did a trial with it. And I would be like a 3 taco guy if I went out to Mexican restaurant. Whereas, you want 2 tacos or 3? And then I transitioned to a 2 taco guy and then realizing even not on the medication, 2 tacos is fine. Right. Because the challenge I had was being like in the bodybuilding space in the past where it's like, I got to eat, 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 eat. I'm not doing that anymore. I'm 40, almost 6 years old. I like to be fit but I do need a certain amount of protein to sustain the muscle and the lifestyle, but I don't need to eat like I used to eat. And it helped me see that I didn't have to eat because I didn't lose a bunch of weight. I actually got more. I got, I lost like 12, 15 pounds of fat, but I kept eating healthy. I just ate less portions and understand like the GLP-1s can be great if you're actually doing the work to transform your habits, right? Even the same thing could be said about something like a Xanax, right? Like we talked about this with, hey, I got anxiety. You give them a Xanax, all of a sudden, how do you feel? I feel good. What changed? Nothing. I took a pill. So is it safe to say that there was nothing really that was the issue? And then teaching someone through mindfulness and through just maybe it's breathing or whatever that's like you can create the same experience inside your body and your mind by doing that. I'm going to help you get there quick with a pill, but I need you to start eliminating the pill and working on the mindfulness. And then all of a sudden, Xanax helped you connect with your ability to like calm down and relax, and like see that your environment's fine, not fight or flight. And the same thing could be said about GLP-1, right? And so it's interesting that unfortunately we've transitioned from a society of like kind of therapeutic processes to here's the pill to
Yeah,
fix.
it's a sick culture with medicine. It's not a preventative. It's not, yeah. We're treating diseases and not trying to prevent disease.
Have faith that we're making the turn, though. I think especially social media, there's so many more outlets of people to get more information. So many great people like you doing the research, having the data, having the patients. Hey, look, I got thousands of people that this has worked for, right? That didn't have to go do that. And the more and more, you know, docs like you that are doing that, it's going to just help move us in the right direction. That's it's better for humanity, right? And so thank you for doing that. And just let's before we hop off, I want to make sure we plug you a little bit. You're in the New Jersey area. So if someone were interested in working with you, what's the name of is there a specific clinic name? Like how would they get in touch with you? And we'll put all this in.
Yeah. Yeah, so my group is called One Oak Medical. I am mostly in the central Jersey area, so I'm on the Jersey Shore, Tinton Falls. I do go to Princeton. I'm probably going to be going to Tom's River pretty soon. So kind of in that area. We do have other doctors that are a little farther north, but these are the offices that I'm typically in. Yeah, we're a multi-specialty group. We have a lot of orthopedic surgeons, podiatrists, non-surgical regenerative guys like me. So it's a good mix because like, listen, at the end of the day, sometimes they need me and sometimes I need them, like sometimes you need surgery. It just is what it is. Like I tore my patellar tendon and I had to get it fixed,
Yeah. It doesn't like that. It can help certain things heal. That's why I kind of joke people. It's like, hey, if you tore something, if something split, all the injections in the world aren't going to bring it back together.
Yep, exactly.
Now it could speed up healing and speed up recovery and strengthen it as you
Yeah.
recover like that. But
Like a non-displaced tear, it can fix, but yeah, when you tear a tendon and the two ends are here.
yeah, it doesn't bring it back together.
Yeah,
There's
exactly.
no PRP to go there and like put a little elves in there to like tie. So, well, thanks for that. We'll make sure all that stuff's in the show notes. It was awesome talking to you. I learned a lot. I think a ton of people are going to get a lot of value out of this. Even, listen, whether you're a doctor and you are looking to expand the way you offer things like this, it's out there, right? You're successful doing it. You're helping a lot of people do it. Or you're a potential patient and you're on the fence. Like, I think there's a lot of great information we shared to help get someone off the fence so they can get healing and everything like that. So grateful to have you on the podcast today. I think this is a great episode that's going to bring tons of value. Any last minute things you want to share before we hop off?
Yeah, no, just always happy to help if there are any problems. I treat from neck to toes. So yeah, and for those doctors out there, if they do have any questions, I'd always be happy to help. I've been doing regenerative medicine for about 16 years now, so I have a lot of experience.
That's awesome. Love that. Thank you for your heart to serve and help. And we'll have all that information if people want to get in touch with you on the show notes. And so that's it for this episode of the 1% Doctor Podcast. I'm your host, Adam Lamb. Thanks for tuning in. Please like, share, and subscribe to this for others that might be able to benefit from this podcast. Thanks so much for tuning in to this episode of the 1% Doctor. Please be sure to subscribe to the show where you're able to consume more podcasts, get more value, and learn more about doctors potentially just like you. Please tell a friend, review the show, and we'll see you in the next episode.